Hi guys, it's Sam. We're going to talk about how to use the new Snyder cages to put a patient in. So first of all, there's 3 compartments. Compartment A is here. This is where the patients go. Compartment B houses the soda lime, the condenser coils, and the drip tray. And compartment C is the control panel. Off to the side, you also have the power cord, the oxygen flow meter, and an additional power cord to hook up like fluids and pumps to, and etc. Okay, so before getting a patient set up in here, you need to open up both compartment A doors as wide as possible. 2 little latches, fling them open. Do this first, and then Daniel here will hold my phone. The next thing you need to do is pull over to compartment B and check that soda lime is good and the drip tray is dry. You have to remove this little red cap, and then the door comes out at an angle and you just pull it down. Be careful not to set it on the touch screen below. Soda lime's in here. You need to make sure that it's not purple and it's only 2 to 3 granules thick. This soda lime looks fine. Condenser coils are here. You should check them with your hand to make sure they're not wet. And the drip tray, these little wings fold in. You go ahead and lift it, pull it out, make sure it's dry. If it's not dry, wipe it out before you put it back. And always make sure to fold the wings back, otherwise it will just leak into the bottom. So go ahead and put your door back on. Same thing, slides in sideways maybe. And then these just twist and lock. And then put your little red cap back in. And then next thing you're gonna do is turn on your flow meter here. So you wanna have it wide open, but it's only gonna show 2 liters a minute, totally normal. Go ahead and turn on the Snyder using the button below the touch screen. It'll start up. Okay, so basic control panels. This is the chamber where the patient sits. This is your oxygen settings, and then this is your CO2 monitor. First thing you need to do before any time you put a patient in is go into the oxygen by touching the word oxygen. You need to wait until this concentration has reached a level point. It appears to be level at 21%, and then you need to calibrate. So you touch calibrate, it's gonna pop up a warning, go ahead and hit okay. And then it'll recalibrate to 20.9, which is room air. The next thing you'll do is pick your set point. 40 is typically where we start. Go ahead and go from there. And then finally, in the mode select, go from monitor only to active output, which goes ahead and puts oxygen into the box. At this time, you can go ahead and set these doors. Oxygen alarm is totally normal. It's just saying that the concentration is low. The alarm pops up. You can just press mute. So go ahead and shut your doors. Okay, so once your doors are shut, after you set your oxygen concentration, you need to go into the chamber temperature. Typically you set the temperature for the patient around 70, which is room temp. You can set it higher or lower depending on the needs of your patient. And then once you pick your right temperature, which we're gonna go with 70, go ahead and hit monitor only again and choose the climate control option, which will heat or cool the unit to the temperature that you need. You can use heat only if needed, or cool only, but typically we won't ever use those options. And dehumidify we'll talk about later. So climate control, go back to main, and then now it should take about 8 minutes to reach your 40% concentration, and you'll see that your flow meter now is at 15 liters a minute. Once it reaches concentration, you can go ahead and pop your patient into oxygen cage. It's important to note that if you have a divider in, the patient needs to stay on the right side of the 2 compartments. And that's how you put a patient into oxygen.